are seeing a concerning surge of COVID-19 cases in our region. In fact, Massachusetts announced that nearly 23,000 people actively have the virus right now. That's an increase of nearly 7,000 cases since the start of this month.
It's prompting Governor Baker to make plans to open some field hospitals. 12 News reporter Kate Walsh joining us live with what that plan looks like.
Well, this morning we're live outside the Rhode Island Convention Center. As you may know, this is a hub for COVID-19 testing in the past few months especially. And inside there are also beds for a field hospital, though that never had to open. It is still on the ready and part of Governor Raimondo's plans should they have to open field hospitals. And in Massachusetts, Governor Baker is doing the same.
Since Labor Day, cases have increased by over 300%, and in the same period of time, hospitalizations by nearly 200%.
Governor Charlie Baker said they're working with the Massachusetts Emergency Management Agency, or MEMA, to identify staffing and locations for field hospitals in the future. Now, in the spring, you may remember those were set up at the DCU Center in Worcester, Joint Base Cape Cod, and one in Boston. And at existing hospitals in Massachusetts right now, the executives are planning how they can move ICU patients into other parts of the hospital, even into parts of the children's hospital wings, to make more beds available and provide more space for an increased number of COVID patients.
We've been running about 4 COVID patients at any given time for months, and now we're running about 12 to 15 for the last few weeks.
Now, we also heard from some executives of hospitals like Mass General who said they feel like they're in better shape right now than they were in the spring because they have a stock of PPE right now at the hospital, and they've just learned from lessons over the past 9 months or so on how to approach this pandemic. Live in Providence this morning, I'm Kate Walsh, 12 News.